What's going on, guys? Dr. Matt here, host of the Rhody Strength podcast. We have another special guest on today, Dr. Ginny Bass, medical doctor. What's going on?
Not much. How are you, Matt?
The Rhody Strength podcast is now brought to you by Rob Levine, the heavy hitter. We've been really happy to have them jump on as a sponsor. I've personally used them this past year. My wife was in a car accident, and they were able to help us along every step of the way through getting properly compensated, making sure we weren't getting taken advantage of by the car insurance companies, and helping through with medical payments. So if you've been in a car accident, it's definitely worthwhile. Just pick up the phone and see how they can help. The Rhody Strength podcast is now sponsored by Athletic Painting and Carpentry. For all of your exterior painting, interior painting, cabinet and door resurfacing, cabinet installation, cabinet remodel, floor refinishing, carpentry, lead renovation, and power washing needs. Give them a call at 401-675-7973. Follow them on Instagram at athletic_painting_, and follow them on Facebook at Athletic Painting and Carpentry. They are an honest, local Rhode Island company that does great work. Doing good. I had the pleasure of meeting you, introduced through Adriana, mutual friend, and I saw you yesterday at her party, her yearly party.
Yes.
Was it? Oh, 2 days ago.
2 days ago, Saturday.
The weekend went by too quick.
It was a fabulous party. Thank you, Adriana.
Yes, thank you. So just to give a quick intro, you're the owner of Seventh Moon Menopause Solutions, which just opened June 14th. So
Correct.
A little over a month.
Correct.
Yep. And this podcast will be released in a few weeks, so by that time, that answer will change. But just recently, and it's located in the Nook at Stalise.
Stalise is a upscale women's clothing boutique. It's fantastic.
Cool.
For anybody who's chopping down in Newport,
Nice.
get on up to Stalise. It's going to be just as much quality, less price.
I
But
love
in
it.
the back of Stalise, there's what I'm calling the Nook. It used to be a hair salon, and that's where we're hanging out right now.
Very cool. And that's over at the Clocktower Square.
Correct.
In Portsmouth.
Correct.
That's cool. That's like, we're here in the Bullfrog Fit podcast studio, as I call it.
Yeah.
But my PT office, which is kind of a similar idea. It's like two businesses that are compatible or help each other, and it makes sense, and they link up. So it's a cool way to do
Well,
it. I like it.
since I'm doing mainly menopause stuff, everybody that comes in that boutique tends to be in the menopause age group. So
Right.
we all are helping each other out right now.
It makes sense.
Except I'm finding that I'm also getting male patients now, and we can talk about that later.
Yes, I would love to. So just to give a quick rundown of your bio. So you're obstetrician, gynecologist, OBGYN, which I think I knew that was what the OBGYN stood for, but you always hear just OBGYN or GYN, then I'm like, oh yeah, it does. That is what the actual acronym stands for. Like
Obstetrics and gynecology.
Right. And you are now a recovering obstetrician.
Correct.
Yes.
I am now a recovering obstetrician. I am no longer delivering babies. I am getting to sleep through the middle of the night. It's been very nice. Although I miss delivering babies, and I really miss my patients. I'm getting older, and this quality of life is much better for me.
Fair enough. I like it.
So I'm a recovering obstetrician.
Yeah. And kind of to expand on, and we'll go off on a little tangent right now, but kind of to expand on that a little bit. I know you said like the quality of life is a bit different, although you loved your job previously, and that has to do a bit maybe with like the medical system in general.
The medical system in general has. United States needs to figure it out.
Yes.
We are losing doctors in droves, and it's mainly due to burnout.
Sure.
PTSD after the pandemic, the lack of being paid, the lack of raises for doctors. I went 10 years without a change in the amount of days I could have for vacations, which is important.
Totally.
And unfortunately, OBGYNs and general surgeons, anesthesia, I'd say, are the last three parts of medicine that are still working 24, 48, 72-hour shifts.
Wow.
A lot of the hospital doctors now are doing shift works where they do 12 hours. 12-hour shifts.
Wow.
Which is much more safe.
Yeah. 72 hours sounds like way too much.
Yes. So changes need to be made.
Yeah.
We're all aware of the changes that need to be made.
Totally.
Big Pharma insurance. It
Yeah.
just it trickles down everywhere where the changes need to be made.
Totally. And that's like, I definitely relate to you with that, because practices like mine, we were just talking about how I'm out of network cash based PT. Like this style of practice wouldn't exist if it wasn't for the out of necessity.
Right.
Like if it wasn't for the entire healthcare system as it is right now, which doesn't seem to be getting better by any means.
No.
Yeah.
No.
Yeah. But
There's a lot of misinformation about socialized healthcare.
Sure.
I think
yeah.
the socialized word is a dirty word for a lot of people,
Yeah.
and it really shouldn't be. It's meant it's to help everybody.
Right.
So I'm cash based also.
Yeah.
But the beauty of it is, if you're with your gynecologist and wanting to talk about menopause, perimenopause issues as that,
Yeah.
you're going to get 10 minutes with your doctor.
Yeah. Yeah.
And with me doing the way I'm doing it, you're going to get an hour with me.
Sure.
So we're going to be able to look at the whole picture,
Yeah,
going from, sleep habits, sexual habits, nutrition, weight, emotional well-being.
Yeah. And with such a potentially complex, or maybe I should say, like, so many different variables are at play, 10 minutes, how much can you really get into that with, with menopause, or, it's like, hi, how you doing? Okay,
really
see you
quick.
later. Yeah.
It's really quick.
Yeah. So you're getting overall a much better experience.
You're getting, as patients, you're getting a much better experience.
Yeah. I like that. I could definitely go on a rabbit hole too with you with like the whole, like, universal healthcare versus like the way it has been and what's best, and I think at the end of the day, like, who knows, but whatever it is, it's not this.
Universal,
Yeah.
And still, you can tell I'm old school using the word socialized medicine. But universal, yes, that's a much nicer word.
It is, yes. So,
it's a little softer fall word.
Totally.
Yeah, I like that.
But we'll leave that for another day. So to continue on with your bio a little bit, you graduated med school at the University of South Carolina.
Medical University of South Carolina, yes, in Charleston, South Carolina.
Is that different from USC
medical school?
Is it the Gamecocks?
Yeah.
Is it the same college?
No,
different. Okay, sorry.
No. I graduated undergrad for the Gamecocks.
Oh, okay, nice.
My mother and my father graduated from Gamecocks. My father used to play for the Gamecocks.
No
football.
way.
Yes, he did.
Right.
Yes, he did. But MUSC in Charleston is a separate.
Gotcha.
It's been around for like 275 years, I think.
Wow.
And the University of South Carolina's and their med school is a much newer program.
Gotcha.
Both of them are great.
Sure. Okay. Very
Schools
cool.
in South Carolina, by the way, are fantastic.
Yeah.
Clemson University, University of South Carolina, got College of Charleston. There's some really good schools.
Yeah. I've been to Charleston a couple times. I mean, obviously, growing up in New England, I'm less familiar with the rest of the country's schools, but no, very cool. So, are you I know we'll get to this a little bit later, but are you a Gamecocks fan then?
I have something really fabulous to tell you.
Okay.
So I'm married to a Polish guy, and, and I think one of the reasons I married him is he doesn't watch football or many American sports.
Nice.
So the only thing I have to watch with him is real football. Soccer.
Okay, soccer.
Soccer.
Gotcha. Very nice.
That's it. So no, I don't have to pretend like I like football so I can get a date anymore.
Love it.
It's freeing.
Love it. That's a great answer. All right. So to continue on the bio a little bit, so you graduated residency at
Carilion.
Thank you. / Virginia Tech in Roanoke.
Correct.
Virginia, in the OBGYN program.
Correct.
Board certified by the American Board of Obstetrics.
Obstetricians and Gynecology.
Thank you.
Say OBGYN.
Thank you. And is a fellow at the American College of OBGYN.
There you
go. Now getting on to kind of what you're doing now. So you work mainly with women in perimenopause and menopause.
Correct.
And then can you break down the difference a little bit of that?
Absolutely.
Yes.
Okay. So we're pre-pubertal. I can't speak either. Pre-puberty.
Yep.
We go through puberty, and then we're in our reproductive years, which is a good chunk of our life, and that is when we can make babies.
Yep.
So going to make a lot of men upset here, but the whole purpose for everything from here to here, in both us and you, the whole purpose is simply making babies.
Sure.
Sperm to go in, babies to come out.
Right.
Okay? So during that time period, the reproductive years is when our hormones are being shot out, whether it's coming from our ovaries, your testicles, or our adrenal glands, etc. They're being shot out in concert simply for making babies.
Sure.
Okay? Perimenopause is, by definition, usually the first 10 years prior to the actual menopause transition. The menopause transition is when your ovaries run out of eggs, your ovaries quit working, therefore they're not shooting out hormones anymore. The average age of menopause is 51 to 52 years old.
Wow.
So most women in their 40s will start having some symptoms of perimenopause, which is where the hormones are not being shot out in concert for making babies anymore.
Sure.
And the way that manifests is there can be mood disorders, period disorders, starting to have difficulties with sleep, depression, anxiety, just not feeling like yourself. And you're still having periods, so most women are going, so what in the world's going on with me? I'm not menopausal, but I'm having all these symptoms. Well, you're not menopausal, but you're perimenopausal.
Sure.
And this is when they need to start taking care of things to help them for long-term health down the road.
Makes sense.
Makes sense?
Very cool. Great explanation on that.
Okay.
So I think, as a man, many of us don't understand it as well as we should. But I think for everybody.
Oh, you're going to understand things by the end of the day.
I love it.
Okay.
So to get into some of the ways that some of the things you're doing as services to help people. First one, we got bioidentical HRT.
Bioidentical HRT. So bioidentical HRT. Bioidentical is a very misunderstood term. Bioidentical means that it is chemically exactly the same compound is what your body used to produce.
Okay.
So the main hormone that our ovaries used to produce was called estradiol.
Okay.
They have estrogens that you can get through pharmacies that are not bioidentical, such as Prempro. That's
like synthetic?
It's synthetic, but it's a different type. And I'm having a brain fart here, but it's a different type of estrogen. It's not estradiol.
Gotcha.
The tablets that a lot of women take or the patches that a lot of women use, those are actually bioidentical, meaning that they are estradiol. They're not estrone, they're not estriol, they're estradiol, which is the main hormone that we produce.
Sure.
And that's a good hormone.
Sure.
We do not have a bioidentical progesterone yet, and I'll explain in a minute why we're concerned with progesterone. So we have the true bioidenticals, and what most people are looking for when they're looking for bioidentical are plant-based bioidentical.
Okay.
Okay, so the other type of estrogen that I've lost the name of it actually was made from estrogen from horse's urine, believe it or not. That's the reason it's called pre-mare, and it's actually got M-A-R-E, Premarin, in the name, and that lets you know that that's coming from a horse's urine.
Okay.
Interesting, huh?
Mare as in the root word or
mare
is horse.
Yeah, female horse.
Yes.
So there are bioidenticals, the plant-based bioidenticals. Yams specifically are the company that I get my pellets from.
Yeah.
You also can get it compounded in creams.
Okay.
The testosterone, the male hormone, which also females have, about 4 times less than what males are supposed to have, but they also have those creams as well.
Sure.
Insurance companies do not pay for the plant-based bioidentical hormones because they are not FDA approved.
Okay. Why are they not FDA approved?
I think it's a big pharma thing.
Okay. Yeah.
I don't want to get in trouble,
Yeah.
but that's
fair. Fair. Yeah.
That's really the only reason. The other reason is there are some really fantastic compounding companies and some not so fantastic compounding companies. You can go to one compounding company back in South Carolina. I did a little test where I put somebody on estrogen and I tested their levels before I put it on the bioidentical cream.
Yeah.
6 weeks later, I did the same thing, and just to see where they were.
Yeah.
There were some women that had no difference in estradiol.
Huh.
There were some women that had a really, really high spike that could be dangerous risk of estradiol.
So there wasn't a good consistency from that company of what they were giving the
Correct.
patients. Gotcha. Okay.
Correct. We actually have in Rhode Island, I think, a really good compounding company.
Nice.
Can I say the name of the company?
Sure.
It's
Yeah.
Bayview Pharmacy.
Okay. Yeah.
Yeah,
I've seen the signs. I've seen them. Yeah.
They do a great job with compounding.
Nice. Okay. Cool.
Okay. And the pellets that I'm using, they come through a company called BioTE, BIOTE. And the only thing that's in the pellet is, and it is evidence-based that you're going to get a consistent amount with these. And it's made from the estradiol and testosterone from plants.
Sure.
It's made into a powder form. There is a very small amount of stearic acid used in the freeze drying process. So you're getting pure testosterone and estradiol.
Gotcha.
And these little pellets look a little bit like a grain of rice.
Yeah. Yeah.
And they're meant to last in a female 3 to 4 months.
Wow.
And in a male, they're meant to last 5 to 6 months.
Wow.
And they're placed just under the skin, back on your hiney.
And I know for men I guess a common alternative maybe would be doing like the injections, which would have to be on a weekly or even
Bi-weekly.
Bi-weekly.
Mostly
Gotcha.
bi-weekly, and there's a problem with compliance there because
Yeah.
we just don't like giving ourselves shots.
Sure.
We don't. So
Sure.
this is for men with low T. So that's another thing that we are treating, as it turns out. I didn't think I'd have many men coming into Stalise, the women's clothing store, to go back to the Nook.
Right.
But these men are coming in with their wives. They're like, test me.
Yeah. Let's see what I got. Yeah.
So, and their main concerns are fatigue, insomnia, physically not feeling as strong as they used to, chronic, joints, aches, and pains. And all of these things we know that testosterone helps with.
Gotcha. Yeah.
So there is kind of a menopause for men. It's not really, it's called menopause of men or andropause.
Andropause. Yep.
And that can start as early with men in their mid-30s.
Sure. Yeah, I've definitely heard of that. And I think men are, at least maybe the people in my circle or like the fitness community are obsessed with their testosterone. Like, oh, I wonder what my testosterone level is. So I think even in the most recent, like, and it could have been going on, maybe it wasn't brought to my attention before that, but in like the past couple years, like I've seen so many of these like test checker like online, like see what go to the LabCorp, like see what your testosterone is, like. So it's definitely like. And men maybe in like the 30, I think probably even younger, like, oh, I wonder if, do I have low T? I hope I have enough T. Like, am I getting enough gains in the gym? Like, it's definitely something men, I think, obsess about a little bit.
As long as they're not getting the anabolic steroids.
Right.
As long as they're getting the true testosterone. And they actually do have low T.
Right. Because you can see it probably issues on the other side of that.
There's issues on the other side, and the most serious on the other side of getting too high with the testosterone in men is cardiovascular issues.
Sure. Overdoing it, and then the risks of like heart-related. Yeah, heart-related issues.
Yep. You can get arrhythmias. It increases the risk of MIs.
Sure.
Et cetera. So you don't want to get too high.
Right.
So one of the beauties with checking the labs is you check the labs before we put pellets in, or we give compounded or something synthetic. We give it 6 weeks, and then we recheck it to see where it is. We know that the optimal level in males, for instance, is between 900 and 1100.
Sure.
That's the optimal level. So if you're down below that, you're a candidate for testosterone therapy.
And this goes off into another side question. I think like if you ask your doctor to check it, is the optimal level and like the normal level for what you get like in the hospital-based setting, are those two different numbers?
They're two different numbers.
Yeah.
There's two different numbers, and it's the same thing with testosterone in females.
So
most of the lab parameters will say up to 82 or 90 on the high end for females, when the evidence that I have seen is suggesting 120 to 150 is the optimal level
Right.
for females. And now in females, you have to be careful because if you get too high a dose, you can get some male facial hair, deepening of the voice,
Sure.
clitoris getting bigger.
Yep.
Am I allowed to talk about
Yeah.
vaginas, tigers,
Yes.
and bears? Am
Yes.
I? Okay.
Yes. Absolutely.
Okay. It's called clitoromegaly.
Yeah.
Sometimes male pattern baldness. But
Yep.
I try to go much lower of a dose than what is suggested at the beginning because you
Sure.
can't take it out, but you can
Yeah.
add in later.
Right.
So we measure levels at 6 weeks, and if it's not where we want it, we can add a little bit more, and the boost is typically free of charge.
Totally. Yeah. That's
Yeah.
awesome.
It is.
Is it? And going back to like the different types of hormones. So when you're testing, and we're probably going way off track here, but that's okay. When you're testing for females, so you're looking at testosterone. Or what are you looking at? I guess when you're going into testing.
When we're testing females, we go in testing. We get a CBC, which is a complete blood cell count. We get a complete metabolic panel. That's just making sure liver, kidneys, all that's fine. That we don't
Yeah.
have some sort of infection. That the platelets are working the way that they should. Then we get estradiol, testosterone, something called follicle-stimulating hormone. Follicle-stimulating hormone is the hormone that is shooting out, telling the ovaries, we need more eggs, we need more eggs, we need more eggs. And when that number gets really high, it means that there's no eggs there anymore. So the pituitary gland just keeps shooting out FSH, saying, give me some eggs, and there
Sure.
are no eggs there. So that number gets very high with menopause.
Gotcha.
We do that. We check TSH, thyroid stimulating hormone, free T3, free T4, and thyroid peroxidase antibodies looking for Hashimoto's there.
Gotcha.
Because thyroid health and the hormone optimization are very closely related.
Gotcha.
The male is essentially the same thing, but we also check a PSA.
Yeah. The
And
prostate.
Prostate-specific antigen.
Gotcha. Okay.
Because we don't want to be giving testosterone to somebody that may have
Enlarged
prostate cancer.
Sure.
So, so this is all about screening when you get older.
Yes. Yeah.
You're probably 20 years younger than me. I'm just going to tell you, I never looked at it this way until I got older, and I went, you know what? This is what screening's about.
Yeah.
You get screened. If your PSA is a little high, go get it checked out.
Yeah.
If it's cancer, you go, yay, you found it.
Right. Early.
Now let's fix it. It's
Yeah.
the same thing with females and mammograms.
Yeah.
Don't be afraid they're going to find something. If you go every year and they find something, you go, yay, you found it. Let's
Yeah.
fix it.
Right. Because if you do the opposite and you wait way too long, then it's much harder to fix it.
Correct.
Yeah.
Or you can't fix it.
Right. Yeah. So that's good. So I want to we'll dive a little deeper into that. That was a great explanation of everything so far. So bioidentical HRT is kind of where we left off. And this will probably blend into what you've been saying already. But another facet of your business is sexual wellness.
Sexual wellness. Yes. Okay, this is the vaginas, tigers, and bears part.
Yes. Yeah, no FDA censorship on the podcast, so
Okay.
you're fine.
Okay.
Or no, FDA, FCC, I don't know, whatever.
All of the above.
Yes.
All of the above, I guess. Do you have any clue what happens down there for females as we get older? Yeah, I mean, just be
no, I
honest.
mean, okay, let me say, in general, actually, not much. Not
Okay.
much now that I think about it, yeah.
So let me tell you what your wife's got to look forward to.
All right.
Okay. And again, the beauty, if we know this early, this is something that we can fix down the road.
Yeah.
The lack of estrogen, and this is for women who are not on hormone replacement therapy. Estrogen helps bring in collagen, elastin to our skin, to the mucosa that's down in the vagina. The blood vessels help bring in moisture down there. When you have a lack of estrogen down there, what happens is everything changes. Because remember, the whole purpose of this is for sperm to go in and babies to go out.
Right.
And for whatever reason, the universe decided that whenever we were out of eggs, that they were going to close all that down because the whole purpose was for making babies.
Sure.
So I don't know if God's a girl or if it's a guy, but either way, it is a really cruel joke, and I can't wait to have a discussion once I get up there.
Sure.
So what that does, it makes everything dry, extremely dry down there, where
Sure.
it just hurts just to walk around,
Sure.
believe it or not.
Sure.
Having sex becomes very uncomfortable, which is a problem because once we start getting uncomfortable with it, we don't want to have sex, and then you guys think that we don't love you anymore or there's some
Right.
problem when the fact of the matter is it hurts.
Sure.
You get urinary tract infections when you do have sex because there's not that barrier of the nice elastin and collagenized tissue around the urethra, so you have sex and you're just beating bacteria into a female's bladder.
Yeah.
I call it death by dick, but anyway.
Yeah.
Okay.
Yeah. That's a good way to put it. Yeah.
So there's a lot of issues down there, and hormones help. And a lot of women don't know that there's hormones that can help down there.
Right. All right. That's That's great explanation.
Okay.
And well put. It's I think palpable, like easy to understand.
Okay.
Yeah. Very good.
Yeah.
Switching next general thing that you help people with is kind of like anti-aging type procedures.
Anti-aging procedures. A lot of this has to go into IV nutritional therapy. We're going to be doing that. I have not gotten much into that, so I'm not going to be able to be an expert on that.
Totally.
But also a lot of the aesthetics procedures because we're going to be doing chemical pills, microneedling with platelet-rich plasma. Have you heard of PRP before?
Yeah, I know of it more from like the physical therapy standpoint of it, like doing PRP injections for like shoulder joint, hip joint, and stuff like that. But not so much from like an aesthetics standpoint.
Okay, so from the aesthetic standpoint, it's fantastic. I'm happy to hear you guys are using that because I know in Europe they've been using it in joints since like the 1980s.
Yeah.
So if you get somebody's blood, you spin it down. The portion that's on top is called the plasma. The red blood cells are down at the bottom of the tube. You take this plasma out, and if you take this plasma out and inject it or place it in the defects caused by microneedling, what that does is it stimulates your bone marrow to produce stem cells, which then go to the site of the injury, and they start building up new collagen. So it's making new tissue there.
Sure.
It's really fantastic.
Yeah.
I think there's going to be benefits for like the crepey skin that we get under here. Right now it's FDA approved for the face and the neck and upper chest there.
Gotcha.
Also FDA approved for some other things, as you said, with joints.
Yes. Yep.
On the sexual hellness things, hellness.
Depends which way you look at it, I guess.
But boom.
Yeah. Right.
The sexual wellness.
Go from hellness to wellness.
I know. I am doing PRP in the vagina or the O shot.
Sure. Okay. Yeah.
Yes.
I've heard of the O shot. I didn't realize that was PRP.
It's PRP.
Yeah. Gotcha.
Yeah, it's PRP. Where you put PRP in the vagina, it helps lift up. If somebody's had 3 or 4 kids and things are kind of sagging down, it helps kind of pull things up. And it's supposed to help with orgasms with females also.
Sure.
So that's another part of the sexual awareness. Sorry, I got off track on that. So back on the skincare, anti-aging, which those kind of go together. We have a really great skincare line called Skin Medica, which has been around for 25 years. I've been using it since I was in my 30s, for crying out loud. Love the product. The microneedling with the PRP, the chemical pills. I think I said that. We're doing dermaplaning. And
what's dermaplaning?
Dermaplaning, I call it the poor girls facial, kind of.
Okay.
It's actually a knife where it goes and it just scrapes off the top 3 or 4 layers of cells.
Okay.
You can put products on top of it. It's usually done in conjunction with, say, a chemical pill. So you get the layers of skin off.
Sure.
You put the peel on it, so you're that much deeper.
Gotcha. Okay. And just rejuvenate new skin.
It just helps rejuvenate new skin.
Gotcha.
Getting the old stuff off.
Gotcha. Makes sense.
Yes.
And then the other one I found, and you probably have more, but coming soon would be weight loss.
I'm working on weight loss.
Yeah. So is that along the lines of like Ozempic style?
I'm getting educated.
Okay.
I'm getting educated as we speak.
Nice.
I don't want to say much about Ozempic because I know patients are having really, really good results with it.
Sure.
My concern is getting people off of it.
Sure. Yeah.
I'm digging, trying to get to evidence to
Yeah.
help me get through that. I don't, as a doctor, first do no harm.
Yes. Yeah.
You want to make sure that you know exactly what you're giving,
Yeah.
why you're giving it, how long is it going to last, are they going to have to be on it forever, what are the
Right.
long-term side effects, and but thus far the GLP-1s seem to be the thing that is working.
Sure. Yeah.
I just need to know a little bit more.
Yeah. That's really good to hear because I feel like I don't know if this is happening or not. I'm not in the world enough to know, but I feel like it's such a popular thing and potentially a moneymaker that people could just be like, yeah, sure, I'll jump into that.
Yeah, but you have to also have patients that are going to do the other things right.
Yeah.
I mean, they've got to, if they're going to do something that they may possibly have to take forever, they need to be exercising.
Totally.
They need to be having a really great diet, having the supplements that they need, et cetera. And if they don't incorporate lifestyle changes while they're doing it,
Yeah.
that's not
It's not helpful.
It's not helpful.
Yeah. No, I'm glad to hear you're
I'm being cautious.
Yeah. That's awesome. I briefly want to go over your mission statement because I really liked it. So I'm gonna read it out loud for us. But so the mission statement, and this is I grabbed right off your website. But
Thank you.
At Seventh Moon Menopause Solutions, our mission is to empower women during the menopausal transition and beyond by providing personalized therapeutic and innovative care. We are committed to enhancing confidence and promoting well-being and celebrating the beauty of aging, ensuring every woman feels radiant and empowered during this transformative phase of life.
Yeah.
Yeah, I love that.
I
And
like it too.
That's really good. So you're really helping women, and I meant to say this earlier, but I've had a couple clients come in and who have and I'm sure this is something you've heard all the time, have come in, have been dealing with like I'm not changing my diet, I'm not changing my exercise from what I did like 5-10 years ago, but I just keep gaining weight.
Perimenopause and menopause.
Yeah, and they're like, I went to my doctor and they checked my hormones and they said I'm fine. and then like, and a couple of these women, they're like, oh, I ended up going to like, this specialist somewhere, like in Boston or wherever. And they're like, oh, there's a difference between like what is an amount of, hormone in you that means you're not quote unquote sick versus what's an amount of hormone that's in you that's optimal. What helps you succeed. Yeah.
Correct.
So like, and just from like hearing a couple of those people tell me anecdotally, like, hey, like I started doing this program and getting my hormones balanced, and it's been a literal game changer like nothing else I've ever done. Yeah. So it's something that like I feel like a lot of people don't quite realize yet, but has the potential to be something huge.
It is going to be huge.
Yeah.
Okay. So I've been putting pellets in women's heinies since 2009. We used to do it very differently. Mm-hmm. We used to not check labs because if a woman was saying, for instance, I'm having periods every month, they're normal, they're regular, we're like, well, we're not going to check your labs because we know your hormones are doing what they're supposed to do.
Sure.
But certain women who say wanted testosterone, we would and they had legitimate reasons, but usually hypoactive sexual disorder. Mm-hmm. And I can go into what testosterone and the female sexual response, how they're
tied.
How they're very loosely related. It's more loosely related than you would think.
Okay.
But given these girls testosterone, they were feeling better, but we were having side effects.
Right.
Okay, women who are not having their periods on anymore are easy. You give them testosterone, you give them estradiol. They also have to have a progesterone if they're if they have a uterus.
Mm-hmm.
Can I get on that briefly?
Yeah.
Okay.
Yeah.
Normal, healthy 16-year-old who's having periods at the beginning of the cycle, her body produces estradiol. Estradiol makes the lining of her uterus nice and thick, ready for an embryo to implant. Mm-hmm. You drop an egg in the middle of the month. You either get pregnant or you don't. If you don't get pregnant, then the ovaries produce progesterone. Progesterone makes you have a period and you start all over.
Gotcha.
Postmenopausal woman, in order to not get endometrial cancer, you have to have estrogen and progesterone because estrogen grows the grass. Progesterone mows the grass. You get the two of them together, it's going to be
Happy.
they're gonna count. It's gonna be happy. They're gonna counteract each other.
Right.
Yes. And now I've just lost where we're going. I got off track. Where was I headed before?
So you're talking about how testosterone loosely affects
The
sexual wellness.
The sexual wellness.
Yes.
Okay. So the male sex drive is driven almost entirely by testosterone.
Sure, makes sense.
It makes sense. You feel it every day, right?
Yeah.
The biggest sex organ for a female actually is her brain.
Okay.
And how we feel about the relationship, etc. Whether you're whining and dining us before you're wanting to go to the sack, or whether you walk in from work and like, hey,
Yeah.
It's our brains are our biggest sex organ.
Sure.
Testosterone, it has been studied over and over and over, and it's shown that it has very little effect. The studies have shown that.
Yeah.
I personally have gotten now to the point, and this hasn't really been studied, so we don't really know, because they've studied male sex drive to death, but they haven't done it with females. I think it's more of a 50-50 thing. I think testosterone, and I can say that because I'm on testosterone now.
Sure.
And there is a difference.
Yeah.
But I still think my brain's the biggest part of it.
Yeah.
If I'm having a week where I hate my husband,
it's not happening.
that testosterone ain't going to take over.
Yeah. Yeah.
And overcome this brain size.
Right.
I mean, the brain part of it.
Right.
Yeah, so it's a combination of the two.
Where in a man, it might.
It's just testosterone.
Yeah. If you're having a week where your wife is driving you nuts, it still might happen.
Yeah,
maybe.
Maybe I'm giving some people some clues out there.
Yeah, right. No, that's good. Marriage advice.
Yeah,
Marriage
seriously.
advice.
And this is not foreplay.
Yes.
That's not foreplay.
Just rubbing. Yep, I feel you. That's good. Actually,
2 glasses of wine and saying something sweet to me, that might be foreplay.
Gotcha. Yeah. Which the motion of rubbing on the hand brought me back to something you said earlier that I meant to ask you about, actually. I know we're going all over the place here, but I think that's fine. And you said for the hormone replacement, you have pellets, you have injections, you have topical, you have oral. Is there a time and a place where you would choose one over the other?
Yes.
Yeah.
Yes. Perimenopausal woman who's still having her periods, the biggest risk with hormones is that I'm really going to screw up their periods and make them very unhappy.
Sure.
So if their follicle stimulating hormone is up in menopausal range, but they're still having periods, which happens sometimes. If I start giving estrogen and progesterone, I really can mess up their cycle. So
Gotcha.
Instead of going directly to pellets, I will do something either like a patch. Typically, it's from Big Pharma, just to see how they do on the hormones and bleeding, just because it's the least expensive. I give them a month or 2 to see what are your periods doing. Is this because I don't want to put in a 3-month pellet. Yeah. And the woman's walking around bleeding the entire 3 months.
So minimal effective dose. Let's see what happens.
Minimal effective dose,
Yeah.
exactly. So sometimes I will play around with either the synthetic or the compounded, like the creams or the shots, et cetera, just to see how it's tolerated. Because once you get a pellet in, it's in there for 3 to 4 months.
Sure. Gotcha. That makes a lot of sense. And that's also interesting, too, how, like, and now it makes sense why it says, like, well, people call it, like, balancing your hormones. Because it really does seem like a balancing act a little bit. Like, let's make sure everything is aligned where it needs to be without doing too much, too little.
Right.
Yeah.
Right. And we recheck labs after six weeks, and we see where we are. If it's not that optimal level, then we can
make a change.
We can make a change. If a woman is having issues with bleeding on it for whatever reason, and some women who've been menopausal for 10 years will have a week where they have a little bit of bleeding, we have ways of managing that and making it stop.
Sure.
Love it. It's a delicate place. Hormones are delicate, like females. We're delicate
like
flowers,
delicate
right?
flowers, yes.
My husband's gonna laugh when he sees that.
Yeah. He's like, not always, no.
Delicate my ass. Yeah.
So let's get into a couple rapid fire questions, just because I like them and I think they're fun.
Okay.
So first, let me ask you, how long have you been in Rhode Island now?
I've been in New England since 2014, so 10 years, so almost 10 years.
All right.
I was in Connecticut for less than 6 months, and I got pulled up to Newport Hospital. So
You're a
10
New
years.
Englander now. 10 years.
Well, why won't this go away?
We tend to stick onto our
I
accents
can't
around here.
stand it. I keep waiting for it to go. First thing I say when I talk to friends down south, I'm like, do I still sound like you?
Yeah, we tend to stick onto our accents. I had roommates who were from Boston when I was at UMass Amherst undergrad, and I still will randomly say some weird words in like a Boston accent. I'm like, where did that come from? But all right. So first question we got is favorite coffee shop you found in Rhode Island so far.
I do coffee at home.
Okay, yeah.
But it's Cafe Bustelo.
Oh yeah, the yellow package.
The yellow.
Espresso or no?
No,
just regular.
Just regular.
Yeah.
Just regular Cafe Bustelo.
I like that.
And by the way, I don't want to take up any space on Earth whenever I die, so I want to be cremated. And I've told my husband I want to be in one of the cans of Cafe Bustelo.
That's fantastic.
Yeah.
I love that. I love that. How about this? Favorite restaurant you found so far in Rhode Island?
Believe it or not, Four Corners over in Little Compton. I love that place.
Nice.
They have a really fabulous Reuben.
Love it.
And I've had a hard time finding my favorite Reuben. I think right now they're my favorite Reuben.
That you're making me hungry.
Yeah,
sounds good.
And I also discovered recently the hamburger over at Gulfstream.
Okay,
is really good.
I've only been there twice. I don't think I've gotten the burger either time, but now I'm gonna have to.
You're gonna have to.
Yeah.
Yeah.
That's a cool little. I always forget about that spot. It's a cool little spot over there.
It's a great spot.
Yeah.
Yeah.
That's good. Favorite recent book.
So, starting my own business here.
Yeah.
And prior to that, in February, I was, working 120 hours a week. I haven't had a whole lot of time, but the last book that I read that I really loved was something called Cutting for Stone.
Sure.
Have you ever heard of that?
No.
Cutting for Stone, written by Abraham. I hope I say his name right. Verghese. It's written over, and it's kind of a medical book. Cutting for Stone means cutting for Dr. Stone.
Oh, okay.
If that makes any sense, but it was over. The place was in India, and then it comes over to the United States. But it's a hard book to describe. But anybody who's in medicine needs to go get it and read it.
Yeah. Is cutting as in like surgery? Surgery for Dr. Stone.
Yes.
Gotcha. Okay.
Yes.
Very cool.
Yep.
I like it. Summer.
Dr. Stone gets the nurse pregnant, who happens to be a nun. And she gets pregnant with conjoined twins who get stuck during the delivery. The mother dies during the delivery.
Oh, wow.
And then the Dr. Stone, who was in love with the nurse, is so distraught, he leaves and moves to the United States. So the story is about these conjoined twins who get disjoined. Yeah, early, and their path that eventually ended up leading them back to the U.S. to their doctor, who was a famous surgeon there.
Wow.
Yeah, it's a really good book, not just for people in medicine, but
just in general.
Anybody.
Yeah, very cool. Okay. Somewhere you traveled recently?
Poland.
Nice. And that's you said your husband's
My
Polish.
husband's from Poland.
Very cool.
Yeah, he's off the boat Poland.
All right.
Yeah.
Very cool.
Yes.
What, good trip?
It was a great trip.
All right.
Yeah, we did. Flew into Warsaw, did Warsaw, Torun, Gdansk, and then Szczecin, then back down to Warsaw.
Very cool. All right. Favorite shoe/sneaker?
New Balance.
All right. Good. Just for like walking around or working out, or?
So, when I was in high school, I was I ran track, and I ran track and long distance professionally, and
cool.
Yes. And I had a bunch of records in my age group. The 880 was my big thing. That tells you how long ago it was. It was still 880. It wasn't 800 meter. It was 880 yards. Anyway, I had really big feet. I still have really big feet. And the shoes for running were so expensive back then, the really good ones.
Oh, yeah.
So I had to share. So everybody shared shoes.
Sure.
So, one person would buy spikes, the other one would buy something for, longer distance. And so I had to share with the guys because I had such big feet. But anyway, New Balance was one of my favorite shoes, and I won more races in New Balance than any other shoe. So
nice. So that's near and dear to your heart.
I still have New Balance shoes.
Nice.
Yes.
When you say you ran like professionally, are you talking about like in college or?
Professionally was not the right word. With Junior Olympics, thought I was going to the Olympics.
Awesome.
Yeah.
Yeah. All right. You were pretty fast.
I was really fast
That's good.
for a white girl.
There
I
we
was
go.
really, really fast.
That's awesome. Was that just curiosity? Is that in was that pretty big? Like where you were at in Charleston? Yeah, South Carolina.
South Carolina,
A lot of
yes.
really fast
Yep,
people
yep,
there.
yep.
Gotcha. Very cool. I just had my most recent podcast was this with this guy Travis Cooper who lives in Rhode Island, really high level weightlifter, and he's from Georgia. I don't think I'm misspeaking here. I think he's from Georgia, like around Atlanta, and his high school just produced like for whatever reason there's like that culture they had there like a Olympian like triple jumper like so it's interesting to see how you have some pockets of areas where people are just like really good at certain things. But side note,
Yeah.
he said and you already answered this, but favorite sports team. Ideally none. Is probably
Portugal soccer.
Oh, okay.
Yeah.
Okay. So football.
Yeah, football.
Football.
Yeah, football.
Nice.
This is not real football. That's what my husband says when he's watching American
He's like,
football.
that's great. That's spoken like a European. Favorite cheat meal? Mexican. Nice. Any places around here you've gone?
No,
No?
I cannot find a real Mexican restaurant in Rhode Island.
There's not many like quote unquote real. There's a lot of like American Mexican
Or
style.
Tex-Mex.
Tex-Mex.
I don't want Tex-Mex. I want Mexican.
There's one place you should check out if you haven't yet called Dolores in Providence.
No, I have not.
That's like the real deal Mexican. Yeah.
That's what I need.
Dolores. Yeah.
Okay.
Check that out. Yeah.
Okay.
They just won like an award. I have a friend who we're getting way off track, but I have a friend who was from Guadalajara, Mexico, and it was the only place he would eat at for Mexican. So
I'm
from
so
an
excited.
authentic Mexican chef, like that place is good.
Okay, you're gonna send me a screenshot of
Yes,
the place later.
yes.
Okay, fantastic.
And then last rapid fire, we got favorite supplements. Biote.
Biote.
Okay,
That's the
okay.
same company that's making the hormone pellets with us, and they have a really fantastic supplement line.
Gotcha.
Pure products. Everything's made the way it's supposed to be with the encapsulation, the things that you need for the supplements. But we have everything from supplements that help with anxiety, supplements that help with, there was one called Serene, Urox, urinary frequency for females. It is working. There are several of the supplements that you have to have with the hormone replacement therapy because it helps keep everything balanced. For instance, if you put testosterone into a female, we have a hormone called, and you guys do too, aromatase, that can convert testosterone to estradiol. Well, I don't want my testosterone being converted to estradiol because I know the estradiol dose I put in and what I want it to be in the testosterone dose. So you have to take, it's called DIM, and it is a long word that I will never be able to pronounce. Men, the same thing.
Yeah. Okay.
A man does not want their testosterone being turned into estradiol.
Right.
Because I do not want you getting man boobs.
Yeah. That's something too that I've seen a lot of people ask about recently. Like, oh, how do I get rid of my like gynecomastia, or how do I get rid of my man boobs?
They need to get their hormones levels
Yeah,
checked
that's
for starters.
that's what I was gonna say. Yeah, that's probably, a hormone issue.
Yeah. Or it could be a familial thing.
Sure,
Meaning,
sure.
Did your dad have big boobs?
Sure. Yeah.
Yeah. It could be that too. ADK. So everybody up in New England is vitamin D sufficient. It's the strangest thing I've ever seen. I mean, even people who go out to the beach every day, they're by God going to be deficient.
Yeah.
We have a great ADK. It's called ADK, and they're all together because vitamin D, for its metabolism, it needs vitamin A and it needs vitamin K also. So we've got packages where we've got everything that you need to keep the hormones optimized. Also methylization.
Gotcha.
Just methyl factor.
Gotcha. Makes sense. Actually, one question I meant to ask earlier on that too, and you said the plant-based, is that what you were talking about with the biote?
Yes.
The plant-based
Yes.
you prefer over some of like the horse urine.
Yes.
And what's the I guess scientifically, like what's the preference? Why do you prefer the plant-based?
It's pure.
It's pure, yeah.
It's pure. You can break it down to into a powder that's pure. It's
Sure.
not going to have any other crap in it.
Gotcha. And versus like the horse urine will have like other like synthetic compounds or.
Yes.
Yeah, gotcha. Okay.
Yes.
Makes sense.
Yes, it makes sense.
Okay. Because I've heard the same thing like
Conjugated estrogen, it just came to me. That's what.
Okay.
Conjugated estrogen, for crying out loud. Conjugated estrogen is not the same thing as estradiol. Premarin is a conjugated estrogen.
So conjugating meaning there's a lot of different things they have
Correct.
to put in to
Correct.
create that.
Correct.
Gotcha. Okay.
Correct.
That makes
And
sense.
just a shout out, ladies, by the way, if you're on Premarin and you're asking your doctors to order an estradiol level, it's not gonna be right because it's not estradiol that you're getting.
Gotcha.
And I've had women I've had doctors that were just putting on more Premarin and more Premarin. But her estrogen is just it's negative, and it's like, well, it's because you're measuring the wrong thing.
Oh God, yeah. Oh man, that's tough. All right, so let's two other big topics I want to get into. One is kind of your backstory, and how you kind of got into starting your own business and going, from the traditional like medical landscape of like you're saying 120 hours a week to now. And then the other piece was like some of the, I guess, like the risk factors to look at it would be a good way to put it. Like how does menopause affect women, like weight, fitness, body weight, and body fat? Some of that stuff we've already talked about, but just in general. But first, I just want you to go into like kind of how did you get into starting Seventh Moon?
Okay. I went through the menopausal transition back at 48 years old. I'm going to be 60 in a couple of months. So I've been, menopausal for 12, 13 years now.
Sure.
I started hormones the moment I became menopausal, just because knowing what I know.
Yeah.
Women's Health Initiative. Do you know anything about that study that was done back in the early 2000s?
No.
Okay. Women's Health Initiative was a bad study. It was done in the early 2000s. They were trying to see what the effects of estrogen and progesterone were on females. It was a bad study in the sense that it had a bunch of older women who probably had breast cancer cells anyway. And lo and behold, a couple of these 70 and 80-year-old women got breast cancer. So in July of 2002, they said, we're stopping the study early. Women cannot have hormones anymore. Take all the hormones off the shelf.
Oh.
So they cut us off.
Oh.
And there are still women that still think that way.
Right.
I've been struggling with that for the past decade being up here. Because down south, we didn't care.
Yeah. Sure.
We didn't care. We're like, I know what the study said. Give me my estrogen.
Yeah. Yeah. Right.
It was completely different up here, and I think it has to do. A lot of the study was done up here, so
Okay.
It's been a struggle getting women to do hormones in the Northeast. But over the past 10 years, I've made really big headway. And when I made the decision to become a recovering obstetrician and get out of the baby thing, this has been my passion.
Yeah.
Since 2009, seriously.
Wow.
Because my transition was so horrible. I mean, women who've never had issues with anxiety and depression, that can be one of the first signs.
Sure.
If you've never had a panic attack and you're in your 40s and you start having panic attacks for no apparent reason,
Yeah.
come see me.
Yeah.
And they don't teach us this in residency and med school. So
Yeah.
when I first started practicing, I had all these women that were coming in, and I was like, you need a psychiatrist.
Yeah.
You don't need me. Boy, when I went through it, I was like, I am so sorry, man. You needed me.
Yeah. Right.
I am
Right.
exactly what you needed.
Right.
So transition can involve, hot flashes and night sweats are the two things. Those are called vasomotor symptoms, and it has to do just the thermostat in our brain is off. Hot flashes feel like you got caught telling a lie is the best way I can describe that, where all of a sudden you get this really like whoosh
Flush.
heat. That's a hot flash. Being hot all the time is not.
Gotcha.
Waking up in a pool of sweat, that has to do with the dysregulation of the temperature center in our brain also. Not every woman has that. New onset anxiety, depression, we have already touched on. That can start in perimenopause up through menopausal transition. And by the way, once you're menopausal, you're always menopausal.
Sure.
A lot of people say, I've already been through that. It's like, no, you're still going through it. The weight starts being an issue. I personally noted at 40 years old, I put on 20 pounds. I had to work like heck to get it off.
Yeah.
I got to 45. There was that 20 pounds again. I had to work to get, and it started every 5 years.
Yeah.
If you don't get it off, the problem is the women who get the 10 or the 20 pounds, and then 5 years later they get 10 or 20, and again and again and again. So it's not unusual when women go through the transition from perimenopause to menopause to put on 30 pounds.
Sure.
If women are aware of that,
Yeah.
you can stop it.
Right. Right.
I'm not a big fan of telling people to get on the scale every day.
Sure.
But during that time period, you might want to, just so you can go, okay, I'm not going to let this happen. Bass said this is going to happen. I know it's going to happen. I'm not going to let it happen.
Yeah. Yeah.
Does that make sense?
Yeah. I like that. I agree with the whole don't obsess about the scale, but I like the idea of just collecting data points. As
It's
I
data
call
points.
them. Yeah, and just see what the data points are doing. Are they going up slowly? Are they going down? Don't worry about the 1 or 2 that are just look weird. But
Right.
yeah,
Right.
collect the data points. See what happens.
Collect the data points, see what happens, and try to see if it has to do with what you're putting in your mouth.
Right. Right.
Right. With the transition comes difficulty with sleep. That to me has been the absolute worst part. You know, I don't have any children, but most women who are out, they get married, they're working, they have children, they've raised their kids. Now everybody's out of the house, and now they can't sleep. That's another discussion I'm going to have up there.
Yeah.
It is just a really cruel. It's a cruel thing. And tell my husband, you never wake a menopausal woman because she's never going to get back to bed. Turns out the progesterone helps tremendously with the sleep.
Gotcha.
Huge difference.
Yeah.
In women's life with the progesterone. We talked about the sexual issues that can happen during the transition.
Yep.
And what else do we have? Oh, the mental fogginess.
Yep.
Which
Appetite.
I don't find that appetite's increased.
Okay.
It's just its metabolism's decreased.
Sure.
Therefore, anything you put in your mouth, it's
sticking.
Sticking.
Yeah.
There's some new evidence actually that intermittent fasting along with HRT, the combination of the two, works really well as far as weight wise.
Interesting. Okay.
Yeah.
I like that. And just HRT meaning hormone replacement therapy.
Yes.
Yeah. Yep. Yeah. I think you mentioned some of these already. Mood, fatigue. We talk about fatigue?
But fatigue.
Yeah.
Fatigue. That's a big sign of low T also with men. Men, low T, decreased sexual function, body aches and pains, joint aches and pains. Testosterone helps with all of the above.
Sure.
So it's not just a sex thing for the guys either.
And then we talked about body fat, but how about muscle mass?
Muscle mass goes away. Got to work harder on that.
Yep.
The change in distribution of where the body fat is one of the most concerning things for the females because it tends to get around here.
Gut.
A lot of my patients say that they feel like a beach ball with 2 Q-tips as legs. They got the little skinny legs and this round part here.
The flat tire.
Yes.
Yeah.
But that stuff can be fixed though.
Yeah. And then this probably ties into fatigue and energy levels, but just general fitness, ability to kind of push yourself in the gym or
yes.
Yeah.
Yes.
Affected. Yeah.
Yes, of course it's affected. But we can all do it. We just have to make ourselves do it.
And we talked about this a little bit already, but kind of the differences between men and women a little bit with some of those things. And how about this? Risks. You talked about the risks from that study a little bit. And that's the thing I don't hear it as much, but I do hear I don't want to supplement with estrogen or testosterone because of cancer risk. But like you said, get screenings.
Get your screenings. That also has been debunked.
Sure.
So the WHI study since 2002, the majority of that has been debunked.
Gotcha.
So we now know that there are risks if you don't take estrogen and testosterone. So estrogen, for instance, let's start in the female body. New evidence that it can help prevent dementia. It helps our skin. It's huge. It helps our skin. It helps build collagen and elastin so that it decreases wrinkles, which makes us feel better. Yes.
Yes.
Which ties
Yes.
into the sex thing.
Yes.
Also. The leading cause of death in females is cardiovascular disease. It is cardiovascular protective. I was on a statin because my cholesterol was up at 300. My HDL was low. My LDL, the lousy cholesterol, was high. I went on hormones. I have not been on a statin in 8, 9, 10 years now.
And that's, correct me if I'm wrong, that's usually one of those drugs where once you have to start taking it, usually people just continue taking it, right?
They continue taking it. There's issues with the statin, specifically with females. Females have a 50% increased chance of developing diabetes on a statin.
Interesting.
Yeah.
I did not realize that.
I was one of them. Yep.
Wow.
Yep.
Okay. And
So got off the statin, went away immediately.
Huh.
Yep.
Is that also, there's another, I think it was a cholesterol-related drug, may have been blood pressure, but I think statin also, there's some joint-related issues with it as well, pains?
Yes.
Is that true?
Yes. Yeah. Joint aches and pains.
Yeah,
etc.
Because I've definitely, I mean, being in the PT world, people are like, oh, yeah, these aches and pains, like, after I start taking the statin, I guess that's a side effect. I'm like, oh, interesting.
Yep.
Like, yeah.
That's one of the most common reasons why people quit them, actually.
Really?
Yep.
Interesting. Okay. Yeah, definitely like a side effect. I feel like that's lesser known.
Yes.
Yeah, as well as the diabetes one.
So, estradiol, it increases your HDL. It decreases your LDL. HDL is the happy cholesterol.
Sure.
LDL is the lousy cholesterol.
Good way to remember it.
Yep. So it increases the happy. It decreases the lousy. It also helps with our blood vessels and the lining of our blood vessels. It makes them stronger.
Okay.
Let's keep going. Bodies of osteoporosis.
Sure.
If women start doing estradiol therapy at a younger age, they're not going to get osteoporosis.
Gotcha.
Now, if somebody has osteoporosis and you start estrogen therapy, you can make it a little bit better. I've never seen it go from osteoporosis to normal. I've seen it go from osteoporosis to osteopenia.
Sure. Okay.
Which is kind of the step in between.
Yeah.
But I also had women who have every risk factor in the book for osteoporosis, and they've been on estrogen, and you go get one at 65 years old, and you're like, you're fine.
Yeah, that's incredible.
That's
another like very, very common. I mean, and a potential risk factor for like dying as you age is like you fall, break a hip.
Yep.
You know. Like,
Yep.
So.
Yep. Statistically,
Yeah.
if you're elderly, you break your hip. One
You're
year,
done.
you're
Yeah.
done.
Yeah.
No, 1 year.
Yeah. So if you can have stronger bones and not break your hip,
Correct.
you live a little longer, which is great.
There you go. Now, the testosterone portion helps decrease inflammation, which is huge. Seen some people with a high CRP, C-reactive protein, which is a marker for inflammation, and they've been on hormones, and I've seen that number go down. I think that's the reason it helps with the joint aches and pains in men.
Gotcha. Makes sense.
Cardiovascular protective. The cancer-wise, there's no
It's been
associate.
debunked.
It's been debunked.
Yeah. It's, I mean, and like you said, like if you're getting screenings and you find that obviously that you have cancer, then like that's a whole nother issue.
You get a good attitude, and you go get it.
Yeah.
You go get it taken care of.
Yeah, exactly. That's
Yeah.
a whole nother issue.
Yeah.
But yeah.
Yay, they found it.
Yes.
I
Go
did
get
my
it.
screening. I'm supposed to do this every 5 years. I do it for like the colonoscopy.
Yeah.
I do it. If they find it, great. I know it's not going to be advanced.
Yeah. And what age is that? I think that's like for men. Is that 40? You start getting that done, or something around there? I know I'm not quite there yet, but it's getting
It's getting close.
Every year is getting
and
close.
They've been and depending on family history. I think I started at 50.
Sure. Okay. Yeah.
That's what I want to think, but I'm not going.
Don't want to misspeak there. Yeah.
I'm not going to misspeak
Yeah.
there because I know that's changing, and I also
Totally.
know like the testing of PSA, et cetera, in men is also changing, and the frequency.
Oh, okay. The guidelines are changing there.
The guidelines are changing there too.
Gotcha. Makes sense.
I still get my husband tested every year just because.
Yeah.
Just cause.
Yeah. That's what it's there for.
Yeah.
All right. So we're at the top of the hour, so I don't want to keep you too much longer. I would be respectful of your time, but thank you so much for coming out. This has been fantastic.
Has been fun.
Yes, it's been very
enjoyed
good.
it.
I want to reiterate one more time. I guess, well, where does the medical system fall short, as in like what? And I think we kind of mentioned it a little bit earlier. Like they're testing things, but they're giving you kind of like what's this? You have just enough like hormones to not be quote unquote sick, but they're not optimal. I guess what are some other ways like the medical system is like not picking up the slack where
They're
it
not
needs to?
doing studies on
Sure.
females, but we just recently, I do not remember the number, but it was a huge number of federal funds that was going to go into studying menopause in females.
Yeah.
Not just, not just for hyposexual disorder and testosterone, which is what they typically test, because there's some dude doctor that's going, it can't be me.
Right.
It must be her.
Right.
But we're finally getting the money in for the testing. I mean, for
Yeah.
the studying. Excuse me. That's been the biggest. That's been the biggest barrier.
Sure.
And open your mind to all these. There's a lot of new stuff that's coming out. We're learning stuff every single year.
Yeah.
I think that this is more about preventative medicine
Sure.
and longevity than it is. I know everything I'm talking about is like talking about feeling good now.
Right. Right.
But the purpose of it and the reason I'm going to be doing it, hopefully till I end up in that Cafe Bustelo can, hopefully I'm going to be living at optimal hormone levels, and I'm going to have a good quality of life. I'm not
Right.
going to be breaking a hip. I'm not, I'm not going to have a heart attack.
Right. Right. I love that. That's great. So a couple wrap-up questions for you. Anything in store for the future, like any events or anything like on the calendar that's coming up you're looking forward to?
Not yet.
Not yet. All right, cool.
We're going to
cool.
have a grand opening, and I want to get people
All
there.
right.
I got so busy the first month. I've got so busy that I haven't been able to do that. But I am.
Hey, that's
I am
good.
going to have a grand opening, and I'd love everybody to come see us at the Nook and Stalise. But I will let you know about that.
Love it.
There are going to be new products and new procedures that we're going to be doing down the road, but that's we're a little at a time.
Down the pipeline. Love
Down
it.
the pipeline.
Anything else that you want to shout out? I know obviously the Seventh Moon,
Stalise.
Yep.
Trist Noon, Noone. He owns Toaster Designs LLC. He is the gentleman that did my website, and I am computer stupid. He has been the best thing for me.
Awesome.
He's fantastic. I suggest him to anyone. A shout out to Adriana
Yes.
Ferns. She has referred, I cannot tell you how many patients to me.
Yeah.
And she's become a friend, and I love her.
Yeah, she's awesome.
Shout out to her. And again, Stalise for allowing us to do that in the back, and
Yeah.
and
Love it.
BioT for having the product.
Yes, very good. And then last question I'll leave you with is the favorite quote question. And the way I portray this is Highway 95 in Providence. So you have there's a few billboards there. So there's the Rob Levine billboard for next to the Big Blue Bug.
Yeah.
You get that billboard for the day, and you can put whatever you want on it. This is the way I set it up is stolen directly from Tim Ferriss, another podcaster. But so you can put whatever quote you want on that billboard for the day. Probably something to tell your community or Rhode Island or clients, patients.
Okay. There's two I like. The one
All
I
right.
remember that is there's a special place in hell for women who treat other women badly.
I love that.
And that was Madeleine Albright.
I love that.
The other one was something along the lines of well-behaved women never
Make history.
make history.
Yes, that's right. Those are great. Those are two great
those
quotes.
are my two favorites.
Those are good. Awesome. Well, we'll wrap it up with that. Thank you so much for coming on.
Thank you for my first podcast.
Yes,
It was
you did
fun.
awesome. It was very fun.
Yay.
All right, very good. Rhody Strength, we are signing off.